In this presentation, we will answer two questions. How is Parkinson's disease diagnosed, and how do symptoms change over time? The primary movement symptoms of Parkinson's disease are tremor at rest, rigidity or stiffness in the arms and legs, difficulty initiating movement or slowness of movement called akinesia or bradykinesia, and postural instability or balance problems. Postural instability is seen late in disease and not at diagnosis. The clinical diagnosis of Parkinson's disease is based on history and clinical examination. 2 of 3 motor features must be present, that is, bradykinesia, rigidity, or tremor. Note that not everyone has tremor at diagnosis, and when tremor is absent, diagnosis may be difficult or delayed. Some helpful features are asymmetry, or symptoms that begin on one side of the body. In this video, you will see that symptoms are worse on the right side than the left. Tremor is not noted with action at this point, or use of the hands. Tremor at rest appears when she rests her hands on her lap. Tremor increases with stress, in this case performing serial calculations. You'll see now tremor is worse not only at rest, but also overflows into posture. This depicts the common scenario which many people with Parkinson's note, and that is stress does make movement symptoms worse. Rigidity is noted in the arms and legs, again with right side predominant in this particular situation. Slowness of movement is noted here. You will see that movements are slow, small, with decreased amplitude, especially on the right. Stiffness is noted in the right leg, worse than the left. Foot tapping is also more difficult on the right. She has no difficulty standing without her hands and no problems with posture. Or postural instability. Walking shows decreased arm swing and decreased stride on the right. These helpful features can differentiate Parkinson's disease from other Parkinsonian syndrome. The DAT scan is a nuclear medicine test that can also help support the diagnosis of Parkinson's disease. The DAT scan differentiates Parkinson's disease tremor from essential tremor, but does not differentiate Parkinson's disease from atypical Parkinsonism or Parkinson plus syndromes. In this slide, you see a DAT scan on the left representing a person without Parkinson's disease, and one on the right, a person with moderate stage to advanced stage Parkinson's disease, and the noted loss of dopaminergic nerve cells. In this slide, you compare the DAT scan from people with Parkinson's disease to a person without Parkinson's disease, mild Parkinson's disease, moderate Parkinson's disease, and severe Parkinson's disease with almost total loss of dopaminergic nerve cells noted on imaging. What is noted is the asymmetry As you saw in the video, movement symptoms typically begin on one side of the body, and this correlates with the loss of dopaminergic nerve cells. That is more significant on that side of the body as well. How does Parkinson's disease progress over time? Parkinson's disease begins on one side of the body, progresses to the other side of the body over time. Early on, symptoms are very responsive to medication, with smooth control throughout the day. Motor fluctuations or dyskinesia become a problem in moderate stage Parkinson's disease. End of dose wearing off is the most common motor fluctuation. In this situation, the effective medications wear off before the next dose of medication is due. Medication doses could be increased, or the number of medications taken can be increased to improve this wearing off. However, medication-induced dyskinesia can become a problem. This is uncontrolled involuntary movement. As Parkinson's disease advances, axial symptoms begin to become a problem. Example of these symptoms are postural instability or balance problems, motor initiation or freezing of gait, speech and swallowing difficulties. In advanced stages of Parkinson's disease, movement becomes less responsive to medications. Here's an example of motor initiation or freezing of gait. Many people describe the feet being stuck or frozen to the floor. Simple measures, such as taking a step back, can help an individual overcome a freeze. Other measures or cueing strategies can be helpful, and a physical therapist can help you determine what works for you. In summary, Parkinson's disease starts with symptoms of tremor, rigidity, slowness of movement. Movement symptoms respond to medications earlier in disease, but as disease progresses, individuals can experience motor fluctuations with signs of wearing off or dyskinesia. In advanced stages, movement symptoms become less responsive to medication, and primary problems are postural instability or balance, freezing of gait, related falls, speech and swallowing problems. Be sure to review any movement symptoms or new problems that you may have with your doctor or healthcare provider. More information about mild, moderate, and advanced stages of Parkinson's disease are noted both on this website and available on the Parkinson's blog.